Health Education for Outpatient Chemotherapy. Chemotherapy involves the use of chemicals to treat cancer by killing abnormal cells within the body and also preventing their further growth. With advances in medical technology, various types of chemical drugs have been developed to treat different cancers and relieve symptoms. Doctors will design a comprehensive treatment plan tailored to your needs. The most commonly used chemotherapy methods in the outpatient chemotherapy room are intravenous injection, peripheral injection of central venous catheters, and artificial vascular injection. Before each treatment, your attending physician will perform a detailed evaluation, including physical examination, blood tests, and so on. After discussing your treatment options with your doctor and deciding on the best course of action, your doctor will give you a prescription for a single injection. Your height, weight, and blood pressure will be measured. Next, take your injection prescription to the chemotherapy room where you will receive the treatment. If family members are around, you can bring the injection prescription to the chemotherapy room and wait to be called for treatment according to the number you will be given. Your family members can then pay the fee and get the prescription. They will be able to find you using the information displayed on the screen outside the chemotherapy room. If you are not accompanied by any family member, please pay the fee first and get the prescription, then return to the chemotherapy room for treatment. If you are late for treatment and your assigned waiting number has already passed when you arrive, please report to the chemotherapy room. You will need to wait until 2 more patients have been seen, and then it will be your turn for treatment. After entering the chemotherapy room, please hand the injection prescription to the nurse. Tell her your height, weight, and blood pressure, then wait for the nurse to make an arrangement for your seat. It is inconvenient to use the toilet while receiving your infusion, so you may wish to use the restroom located across from the treatment room before receiving your treatment. Please place the injection drugs that are next to your seat into the box with the corresponding numbers on it. The box also contains your oral medications. Remember to take them home and take them on time. Wear your National Health Insurance IC card around your neck using the lanyard provided. The nurses will double-check your name before administering the infusion. Please take the initiative to tell them your name and date of birth. If you feel cold, please feel free to take a blanket from the locker. At the end of your treatment, please place the blanket into the soil-closed receptacle. During the infusion, you can eat or drink. If you need to throw up, please use the vomit bags and toilet paper on the table. If redness, swelling, heat, pain, or dampness develop at the site of injection, please inform the nurse immediately. Once the chemotherapy treatment has been completed, side effects might develop, but most of them will gradually disappear. The occurrence and severity of side effects may vary according to individual tolerance of the chemical drugs and dosage used. If side effects develop, please discuss them with the medical staff in the treatment room. Side effects: nausea. One of common side effects of chemotherapy is nausea. Some drugs will activate the vomiting function in the brain and cause nausea and vomiting. The following suggestions may help you reduce nausea and vomiting. Avoid overly sweet or greasy foods. Do not eat much before treatment. Eat small meals. Avoid eating liquid food or drinks, thus reducing the sense of fullness. Avoid drinking liquid food within an hour after a meal. Take a short break after eating and avoid exercise after eating, which may cause indigestion. Relax your body. try to take deep breaths or listen to music to distract you from the feeling of nausea. Hair loss. Not all chemotherapy chemicals induce hair loss, and if hair loss does occur, it will usually grow back at the end of treatment. Only a small amount of hair will be lost, or the quality of the hair will change in some patients. You can refer to the following guide for hair caring. When signs of hair loss occur, cut it short, which makes your hair look thicker and also easier to clean. Do not dry your hair using very hot air. Use mild shampoo. Use a soft comb. Do not color, perm, or curl your hair to avoid adding pressure on the scalp. Use a hat, headscarf, or wig to protect the head, improve your appearance, and help maintain self-confidence. Anemia. Another side effect of chemotherapy is anemia, as it may inhibit bone marrow from producing red blood cells, which are responsible for carrying oxygen to the body. If red blood cells are too low, body tissues cannot get enough oxygen, which can lead to anemia. Discuss with your doctor ways of dealing with anemia. Here are a few points that you should be aware of. Increase sleep duration at night, and also try to find time during the day to relax. Reduce daily activities. Do not be afraid to ask others for help. When you sit or lie down, do so slowly to reduce the possibility of dizziness. Intake of iron-rich and high-protein foods is encouraged. Weak immune system. White blood cells are important in the body's defense mechanism. So if the number of cells is too low, the body's immune system will be undermined and become more vulnerable to infection. Therefore, the physician will check your white blood cell count. If the number is below normal, the physician will decide whether to terminate chemical treatment. The following suggestions can help you prevent infection. Avoid crowded places. Wear a face mask, especially when you are in public places. Wash your hands often and keep them clean, especially before eating or after using the toilet. Do not squeeze or scratch pimples and acne. Use a soft bristle toothbrush to avoid irritating the gums. Do not cut the skin when cutting nails. Use an electric shaver rather than a razor to avoid cutting your skin. Avoid eating lettuce, sashimi, and other raw foods. Avoid dairy products such as probiotic drinks, such as Yakult, yogurt, buttermilk, milk, etc. Peel the skin off fruits or wash the fruit in hot water before eating. Common symptoms of infection include fever over 38 degrees centigrade, chills, sweating, burning urination, severe cough or sore throat, abnormal vaginal discharge or itching, redness, swelling, heat or pain in wounds or at intravenous injection site. Some anti-cancer drugs can cause dryness, pain, or ulcers in the mouth and throat. Furthermore, bacterial flora in the oral cavity may also cause infection. Therefore, prevention of infection and good oral hygiene are very important. The following recommendations can promote oral hygiene. Before chemotherapy, ask your dentist to perform a detailed oral examination and fix any problems, such as tooth decay and gum disease. Brush your teeth after each meal. A soft bristle toothbrush is recommended to avoid irritating the gums. Don't drink flavored or sweetened drinks, which may cause bad breath. Use mouthwash frequently. If you buy your own mouthwash, avoid ones containing alcohol or too much salt. If mouth ulcers develop and cause pain when eating, you can try the following methods. Inform the physician and apply ointment according to the doctor's advice. Eat cold foods or foods which are near room temperature, such as ice cream and pudding. Warm foods can irritate a sensitive mouth or throat. Choose soft, bland food such as porridge, eggs, pasta, ice cream, pudding, or jelly. Use a blender to mix food into baby food, which will make it easier to swallow. Avoid irritating, acidic foods such as plums, tomatoes, citrus fruits, grape juice, lemon juice, and so on. Avoid spicy, salty, or rough, dry foods such as hot pot, toast, and biscuits. If a dry mouth causes difficulty swallowing, you can try the following methods. Take frequent small sips of water to keep your mouth moist. Stimulate secretion of saliva by holding ice cubes in the mouth or chewing sugarless gum. If the lips are dry, apply lip balm. Diarrhea. When chemicals affect the mucosal epithelial cells in the digestive tract, diarrhea might develop. Antidiarrheal medicine may be prescribed depending on your situation. Do not buy antidiarrheal medicine without first consulting your doctor. The following methods will help to control or reduce the chance of developing diarrhea. Eat a light and liquid diet to reduce the burden on the intestines. For example, filtered broth, diluted fruit juice, or sports drinks. Eating a light liquid diet does not provide the body with enough calories, and therefore this diet should not be followed for more than 5 days. Intake of at least 2,000 cc of water per day is suggested to supplement the loss of water due to diarrhea. Avoid intake of high-fiber foods such as whole wheat bread, cereals, and fruits. Avoid food and drink which stimulate the intestines, such as coffee, tea, sweets, and greasy foods. Avoid milk or dairy products if they cause diarrhea. Unless your physician suggests otherwise, eat small quantities of food rich in potassium, such as bananas, oranges, potatoes, and dark leafy vegetables, such as spinach. If diarrhea has improved, low-fiber foods, such as white bread, white rice, pasta, eggs, mashed potatoes, vegetables, and soup can be included in your diet. Other side effects. Some chemotherapy drugs can cause peripheral neuropathy, i.e., a tingling or numb sensation at the end of the limbs. You might find it difficult to pick things up or have difficulty buttoning up clothes. If such neuromuscular symptoms occur, be sure to inform your doctor. To prevent injury, avoid handling hot or sharp items. During chemotherapy treatment, you may develop skin problems, including redness, itching, peeling, dryness, and acne. Nails may turn black, become fragile, break easily, or striped lines may form on the surface of the nail. Some chemicals may cause allergic reaction after intravenous injection, which could make the blood vessels become red, hot, or painful. Some anti-cancer drugs may darken the skin as the drug moves along the vein after intravenous injection. This will fade within a few months. Using warm water for showers. Lotion can be applied to prevent dry skin after a shower. If acne appears, keep the face clean and dry. Remember to wear gloves to protect nails while washing dishes, planting flowers, or doing other housework. Chemotherapy will bring many changes to your life. You may feel frightened, anxious, angry, or depressed during chemotherapy. These feelings are normal and understandable. Here are some tips which will help you to cope. Consulting physicians and nurses. Please ask staff any questions you may have about your cancer treatment. Our team is trained to provide you with a wide range of assistance and support. Maintaining good communication with friends and family. Talking with friends and family about any issues you may encounter, as well as emotions you may experience during treatment, is enormously beneficial. Consulting counselors. Our psychological counselors and social workers are available to assist patients undergoing chemotherapy treatment. Joining support groups. Join a cancer support group such as the Cheers Association, Cancer Association, or Hope Association. Support groups allow patients to share their experiences and provide emotional support and encouragement. Maintain a relaxed and positive outlook through spiritual practices, listening to music, reading, gentle exercise, and gardening. Although chemotherapy might cause some unpleasant side effects, it is an important weapon in the fight against cancer. After chemotherapy, any side effects will disappear, and you will be able to return to your normal life. Please keep this information to hand for future reference. We wish you a speedy recovery.